Influenza, also called the flu, is a contagious viral infection of the nose, throat, and lungs that spreads easily from person to person. When someone who has influenza sneezes, coughs, or even talks, the influenza virus passes into the air and may be inhaled by anyone in close proximity.
Families Fighting Flu strongly supports the CDC's new recommendations for everyone 6 months through 18 years of age to receive the influenza vaccine. Parents need to get the facts about childhood influenza vaccination and understand the dangers of not vaccinating their children and families. Influenza is a serious and debilitating disease that can lead to serious complications, even death.
Influenza is very serious and potentially life-threatening. Influenza and its complications claim an average of 36,000 lives and hospitalize more than 200,000 people in the United States every year. Each year, in children younger than 5 years of age, influenza causes approximately 20,000 hospitalizations and nearly 100 deaths. For more information, visit preventchildhoodinfluenza.org or preventinfluenza.org.
Influenza is a serious and potentially deadly disease that spreads very easily. Anyone can get influenza, but rates of infection are highest among children. Younger children, like infants and toddlers, are at a particular high risk of serious complications, including hospitalization and even death. For more information, please visit preventchildhoodinfluenza.org.
The National Foundation for Infectious Diseases and the Centers for Disease Control and Prevention believe a yearly influenza vaccination is the best way to protect children against influenza. Not only are children at risk for influenza when unvaccinated, but infected children can transmit influenza to vulnerable groups, such as young babies, grandparents, and people 50 and older. Influenza vaccination should begin as soon as the vaccine is available, which is usually by October. However, influenza cases don't usually peak until around February each year, so getting immunized anytime in the fall and winter into January and beyond is still useful.
There are two types of influenza vaccines available in the U.S. The injectable vaccine includes dead influenza viruses and is approved for use in anyone 6 months of age and older. The nasal spray vaccine uses live but weakened influenza viruses. It is approved for use in healthy people 2 to 49 years of age and is not recommended for pregnant women or people with certain medical conditions such as asthma. Neither vaccine can cause influenza. For more information, visit preventchildhoodinfluenza.org or nfid.org.
Vaccine effectiveness can vary, but the vaccine can be as much as 70 to 90% effective in preventing influenza infection in healthy adults younger than 65 when the vaccine and the circulating virus are well matched. Circulating influenza viruses usually change from year to year, and because of this, a new vaccine is made each year to provide the best protection possible. The influenza vaccine is effective only for the current season, so it's important to get vaccinated every year. For more information, visit preventchildhoodinfluenza.org or cdc.gov.
Influenza vaccination cannot cause influenza. The most frequent side effect of the injectable influenza vaccine is soreness at the injection site for 1 to 2 days. Occasionally, some people experience a period of mild fever and fatigue for a day or two following vaccination. Side effects from the nasal influenza vaccine are generally mild and temporary. The most common side effect is a runny nose. Other side effects include cold-like symptoms such as headache, cough, sore throat, tiredness or weakness, irritability, and muscle aches. For more information, go to preventchildhoodinfluenza.org.
There are many opportunities for children and anyone who seeks influenza vaccination to get vaccinated. Parents and healthcare professionals need to rethink the traditional vaccination season by seeking and giving influenza vaccine as soon as it is available and using every opportunity, and that is sick and well visits, to get vaccinated throughout the fall and winter months and well beyond the new year. The take-home message from the American Medical Association is protect yourself, protect your family, and get vaccinated.
The Asthma and Allergy Foundation of America believes that yearly influenza vaccination is safe and effective for children with asthma. It's especially effective for people who have compromised immune systems or other underlying medical conditions, such as diabetes or heart disease. Now, this is because influenza can really worsen chronic medical conditions like these, or can cause serious complications in people who have chronic illness. For example, medical professionals have known for years that influenza really causes many of the asthma exacerbations and emergency room visits among people who have asthma. So for more information about this, you can visit preventchildhoodinfluenza.org or AAFA.org.
In some cases, entire school districts have been forced to cancel classes due to extremely high levels of absenteeism due to influenza. Influenza can take hold of a school very quickly because the virus spreads very easily from person to person. The less than stellar hygiene habits common in school-age children increases the risk of transmission even more. For more information, visit preventchildhoodinfluenza.org.
Vaccination is the best and safest method to protect pregnant women and their unborn children against influenza. For more information, you can get it at preventchildhoodinfluenza.org.
It's important for healthcare professionals to be vaccinated against influenza because they can very easily transmit influenza to others if they're infected. This is particularly troublesome for vulnerable patients in their care who may be at an increased risk of severe complications, including influenza-related deaths. The Centers for Disease Control and Prevention strongly urges all healthcare providers to get an influenza vaccine every year. For more information, visit preventchildhoodinfluenza.org or cdc.gov.
Influenza is a highly contagious virus that is spread through the air by sneezing or direct contact. The viruses infect the respiratory tract, causing high fever, headaches, respiratory complications, muscle aches, and extreme fatigue, leaving persons lethargic for weeks. Influenza puts infants and toddlers at significant risk for hospitalizations due to pneumonia, respiratory conditions, heart failure, and other serious health problems. Transmission of influenza viruses can occur rapidly among young children, especially in daycare or playgroups where they are in close contact with each other.
The baby had a cold for. Hi.
About a week now. She's sneezing, she's coughing, her nose is running. You okay? You teepee? You teepee?
Let's lay her down now. Hold the phone. Okay, you want to blow as big as you can. Go. Okay. That's better. You ready? Big, in, and then out. That's okay. Very good. Okay, see, and as the numbers go up, that means you're getting better.